The following program contains mature subject matter not suitable for young viewers and graphic images that may be disturbing. Viewer discretion is advised.
Our country, and these are important headlines because we know our country has been ravaged by a deadly opioid epidemic. We've been talking about this time and time again. The deaths keep on occurring, but now a popular coffee shop is installing needle disposal boxes in their bathrooms. The idea is to protect their employees. So what Starbucks plans to do is install these disposal boxes in locations across the country, including Seattle and Philadelphia. Apparently, workers reported finding blood and discarded needles and syringes in the bathrooms. Of course, you can take every precaution as an employee, but say you're cleaning up a bathroom, and if there's a needle there,
yeah,
very easy to potentially.
Sure, they'll throw them in with the regular garbage. It's a plastic bag, so easy to stick yourself. And why is this such a big concern? Well, a dirty needle, it can transmit
HIV, hepatitis.
Hepatitis, exactly.
Yeah.
I like this step because I think you have to think about employees.
Well, they're protecting their employees. And, you know, the scary part is that if you're finding needles at Starbucks like that in weird places, you have to assume the worst, that these are drug users, which puts them in a high-risk group for all of those potentially life-threatening conditions.
But what I love is that the employees, they advocated for themselves. So about 4,000 people signed a petition saying, hey, we want to make sure that we're staying safe at work. And they requested, you know, something to help them stay safe.
So question for you.
So I think
what would you say, because there are counter arguments, and the counter argument would be that you are then promoting drug use by having these, okay, and I agree with all of your responses there, but there are individuals who say, oh, don't do this. You're now encouraging people to go use your bathrooms to do drugs.
I don't think so, because when people do drugs, then their primary concern is not if somebody else is going to get stuck with their needle. So I don't think they care.
The question is, are they even going to use the receptacle?
You know, one of the other questions is that Starbucks has this open bathroom policy. They're one of the few that do it. And
open store, open bathroom policy, yeah, you're right.
And I've taken advantage of that. Now you understand, and I never thought of it, why do so many places really discourage you using their bathrooms unless you're a patron? And I guess part of it is that this is a bigger problem that we realize people will use those bathrooms to do IV drugs.
And so a couple of comments. If you are accidentally stuck by a needle or any other object that theoretically could be carrying the bodily fluids of someone else, you really do need to be seen soon. You know, certainly in the hospital, we will look and see if we can figure out who the source patient may be, because then you can at least risk stratify. But this isn't one of those things where if you get stuck, you hang out for a few weeks to see if anything happens, because this post-exposure prophylaxis is something you need to look into ASAP. Starbucks did previously release a statement. These societal issues affect us all and can sometimes place our partners/employees in scary situations, which is why we have protocols and resources in place to ensure our partners are out of harm's way.